folks, welcome back to my channel. Today we're going to talk about Medicare Supplement Plan G versus Plan N and the factors that you want to consider in order to pick the right plan for you. Okay, this video pertains to you if you have a Medicare Supplement Plan or if you have a Medicare Advantage plan and you're considering Medicare Supplement Plan as an option. Uh, First off, let's go ahead and open up the 2022 Choosing a Medicare Policy. This is a guide released by Medicare and helping Medicare beneficiary further understand different types of Medicare plans and how Medicare or Medicare Supplement Policy works. If you would like to follow along, you're able to go to Google, type in Choosing a Medicare Policy, and then it should be the first link, and you know it's the legitimate source because it's from Medicare.gov. You want to click on that, and then let's talk about Medicare Supplement Plan G versus Plan N. Okay, first off, if you have a Medicare Supplement Plan F and you're considering Plan G or an N, this is the video for you. Or if you have a G or an N and you're looking at the other option, this video is for you as well. So let's go straight ahead and dive right into it, okay? First off, Medicare basics. Original Medicare consists of two parts. Part A for hospital insurance. Anything that is inpatient overnight stay, it falls under Part A. Anything Part B, your second portion of your Medicare, are medical insurance. Anything outpatient services, you go in, come out the same day, such as your primary care visits, as well as your specialist visits, your durable medical equipment, and many of your preventive services falls under Part B. As you may know, Medicare coverage only covers for medical services. It does not have prescription drug coverage, dental, vision, nor hearing. And Medicare Supplement are designed to pick up the costs that Medicare does not cover as long as it is a Medicare covered services. Generally speaking, when it comes to your outpatient services, Medicare only covers 80% of the cost, and you have no cap on that. If something catastrophic were to happen, your 20% could surmount to a larger amount, you know what I mean? And then your Medicare Supplement steps in and pick up all that 20% cost that Medicare did not cover that you would have been responsible for if you only had original Medicare. And because of these gaps, you want to pick up a Medicare Supplement plan. And there's quite a multitude of options. Private health insurance companies are able to offer different types of Medicare Supplement plan that are distinct, that you can differentiate by their letters from Plan A through N. Medigap or Medicare Supplement policies are also standardized. So a Plan G or a Plan N with AARP Medicare Supplement is exactly the same thing down to the fine print with a different insurance company such as Humana, Cigna, Aetna, Blue Cross Blue Shield, Mutual of Omaha. They're all exactly the same thing. But obviously, the differentiation is that the premium that each insurance company are able to offer are different. So here's a Plan G, okay? Plan G covers 100% of the cost that you would have been responsible for if you only had original Medicare. All the cost sharing of the 20% of the deductible, Plan G picks that up. Medicare Part A co-insurances, your Medicare Part B co-insurances, co-payment, 100%. Blood, your Part A hospice care, home health care, 100% of the cost. Your skilled nursing facility care, up to 100 days. Medicare Supplement Plan G covers that 100%. Part A deductible, it covers 100%. The only responsibility that you have to be concerned about is your once per calendar year Part B deductible of $233. That is only relates and pertains to outpatient services. So let's say during the beginning of the calendar year, you chose to go see your primary care physician or specialist. You would then, at that time of service being rendered, you'll be responsible for that $233. Once that amount is satisfied, Plan G will pick up all of your Part B co-insurances. 100%. Your Part B access charge, 100%. It also covers 80% of foreign travel emergency. Here is the distinction between Plan N. By the way, every insurance company, and if you get a lot of mails, every template or mailers that you open up, you may notice this chart again, because it's all standardized between every insurance company. They all have to offer the same plan. The only key distinction is just the premium, maybe the service that you get from them, and some of them give you a silver sneaker as well, some don't. Here's a distinction between a Plan N and Plan G. Plan N, exactly the same thing. The only difference is that Plan N, it covers 100% of your Part B co-insurance and co-pays, but with the Plan N, you have a little bit of cost sharing involved. With Plan N, you have up to $20 copay for office visits, and that relates to your primary care physician as well as your specialist, and also up to $50 copay for ER visit that don't result in inpatient admission. So with your Plan N, you have a little bit more out-of-pocket expense for your doctor visit and your ER visit. Other than that, everything else exactly identical, 100% on Part A hospice coinsurances, your blood, your skilled nursing facility, your Part A deductible. It also does not cover your Part B deductible, but that's the same with Plan G. And an access charge. Plan N does not cover for access charge. And if your question is, what is an access charge? An access charge is if a doctor chooses to bill you over the Medicare assignment. With every medical services that are rendered, Medicare has a fee schedule and a assigned amount they pay out to provider for each services rendered. This is if doctor chooses not to accept that amount and they want to get more money or charge the patient more, they're able to do so up to 15% over the Medicare assignment amount. So for example, give you an example here. Let's say you went in for a primary care physician visit at your doctor, right? And it costs $100. Medicare assignment says that they'll pay $100. The doctor, if they don't accept that Medicare assignment, they're able to charge 15% over that amount. So that would mean that they would charge $115. So that extra $15 you would have been responsible for, and Plan N does not cover that difference. Plan G, however, on the other hand, does cover your access charge. But again, if you run into a provider that doesn't accept Medicare assignment and is going out of their way as a practice to charge you an amount that is over what Medicare is willing to pay for, and you as the beneficiary would then be responsible for, that kind of raises an eyebrow and raises a concern, because do you really want to work with a provider like that unless they have a valid reason to do so? But in today's day and age, you never or hardly ever, in my nearly decade of experience in this business, I think I've only seen it once that a doctor did not accept the assignment and the member ended up having to pay the difference. Usually when I see that, I advise the patient or the member to perhaps consider a different provider that isn't going to do that. And one way that you can avoid an Part B access charge is just by double checking with your provider if they accept the Medicare assignment, before you book your appointment or service. The last thing that you want is to get a surprise bill and find out that your doctor billed you more than what they were paid by Medicare. So just take that into consideration. And to give you a little bit deeper perspective on a Plan G and a Plan N premium differences, here is my broker portal. This is what I use to quote prospective member or my client with different type of policy. At the age of 65 for a Plan G in the state of Utah, since this is where I reside, Plan G, and there's a lot of different insurance company, but I always advocate going with a company that is reputable, that is household recognized name, because you want to work with a company that has a proven track record and a history of being around in the market. You don't want, the last thing that you'll want is go with the insurance company that is providing you with the lowest premium, and then a few years from now they pull out of the market, and then you're left high and dry, and then you have to shop for a different plan. It's too much hassle. I always advise invest a little bit more to go with the company that is reputable. So one example is AARP United Healthcare. They're the largest insurer in the nation. Cigna, for example, Plan G at the age of 65 is $116.26. AARP, on the other hand, is $119.54. Your premium will be lower if you have a household member that will be getting on a plan with you, but if not, and if you're just an individual, in most cases, your premium is going to be around 116 to 119 per month, okay? So keep that in mind. And then Plan N, on the other hand, by the way, also, as an agent and broker, I am able to look at the different rate increases too, because another distinction is you want to go with a reputable company because the rate increases are typically much more predictable than going with a smaller insurance company that you never heard of. A lot of time they issue you an appealing premium to entice you to enroll with your plan, and once you become a member, a couple years down the road, you'll experience a high rate increases that sometimes can result in the double digit, and you're faced with that consequences. So pay a little bit more, go with the better insurance company that has a proven track record so that it's predictable. Your rate increases are lower because they have a larger book of business. They're able to spread risk unlike other insurance company can. But as I talk about, look at Cigna. The premium rate increases extremely stable, 0.5 in the last 4 years. And then you look at AARP, 0.1% in the last 5 years. In 2020, their premium actually gone down by 13%. And I had the privilege to deliver all that good news to my clientele. So 116, 119, and if you go look at Plan N, here's what the difference in premium looks like. Remember, Cigna was 116, AARP was 119, and the premium difference between a G and an N is this. So let's go back to Cigna. $80.31 with Cigna for a Plan N and AARP. So that's about $40 difference with Cigna. And then AARP United Healthcare is $98.65, about a $20 difference, right? So the distinction that you really want to take into consideration is that if you don't like the idea of Medicare Advantage plan and you're confident and informed and educated about your decision with going with Medicare Supplement Plan, but you're choosing between a Plan G or a Plan N, take this into consideration. Are you able to afford the little bit more in premium that you would be responsible for with a Plan G? Because with a Plan N, even though you are saving on your premiums between 20 to 40 bucks, ask yourself this question: how many times in a year do you have an office visit? And make sure you include both your primary care and your specialist, because let's say you go to a office visit once a month, that's already $20 per month. And that is about the premium difference that you're saving between a Plan G or a Plan N. So if you're seeing a provider about once a month, then I would most likely advocate that you just go with a Plan G, because with a Plan G, you don't have to, pay for a copay each time a service is rendered, and you have the peace of mind that the excess charge is covered. On the other hand, if you like the idea of a Medicare supplement and you want to have total freedom and flexibility and have essentially all your costs be covered for, but you want to pay a little bit less in premium, Plan N would be a good option for you if you don't visit the doctor as often, right? You're not seeing a doctor once a month. You're maybe seeing your doctor 3 to 4 times a year. 3 to 4 times a year, that's only about $80 in copay throughout the year. And the premium that you're saving, again, is about $20 to $40. Times that by 12, that could be between $240 to $480 in premium savings. So if you're not seeing a provider as often, I would highly advocate a Plan N for you. But if you're seeing a doctor more frequently, then Plan G is a great option for you. So yeah, in summary, here again, the difference between a G and an N is that with the N, you have $20 copay for some office visit and $50 for ER, and your plan N does not cover access charge. And your premium can be between $20 to $40 less than that of a Plan G. So that sums up the video. That's the difference between Plan G and Plan N. I hope I've been helpful and am able to empower you to make informed and educated decision going forward. If you want help on finding the plan for you, you can reach out to my office. You can call me at 801-255-5341. I've been a Medicare specialist for the last about decade. I'm also independent. I work with pretty much all major insurance carrier. But my duty is to serve my clients and the people that I work with, and to help you, empower you to make educated and informed decision about your health insurance option. It's not just a one and done deal. I don't just sign you up and disappear. I actually stay in constant contact with you. You have my cell phone. You have my office contact information, that when you need assistance with your claim, your bill, having questions to be answered, I'm always, a phone call away. You can text me, email me. I have a 24-hour return call guarantee policy. If I don't, I'll take you out to lunch. And overall, my service does not cost you a single dime. My service is free to you. I would love the opportunity to be able to work with you and earn your business. But other than that, that's it for today's video. Hope you have a wonderful day. Bye-bye now.